Hello, hi, this is Dr. Erica. Thank you for joining me on today's topic. Today I'm going to be talking about kidney stone and what is pharmaceutically available on the market to help with kidney stones. I have um, had personal experience with kidney stones, so I can talk about this topic in detail about my own experience. And I do have some key facts that can help with reducing the amount of kidney stones in the body and help to reduce reoccurrence of kidney stones. So do be aware of that. I also want to just make mention that please subscribe, like, and share to this channel. I'm Dr. Erica. I'm a pharmacist for close to 10 years. I have a background in pharmaceutical, which includes the development of medications, the approval of medications, how that affects the body, how the body affects medications, things like that, and also how to treat certain diseases that may require treatment through pharmaceuticals. So I have vast experience, and so please subscribe to this channel and stay tuned because I give information about my personal experiences, experience in the professional field as well. So most of my background is comes from retail pharmacy. I'm currently independent. I'm a pharmacist. I work for myself. I have a business called Millennium Pharmacy, and you can visit my website, themillenniumpharmacy.com, for more information and products, over-the-counter products as well, medical devices. And I have this platform as well. I'm also on Twitter. I'm also on TikTok. So do please visit those platforms also. So today we're talking about kidney stones. Kidney stones occur in the kidneys, mostly in male gender versus female gender, but females are also likely to get kidney stones as well. It's not gender specific, so do be aware of that, but most likely it's going to occur in the male gender. It does occur usually when there's a buildup of minerals in the blood system. Mostly it's going to be Ca or calcium mineral that can occur in the blood system. When that occurs and it filters through the kidney, it becomes a stone because it's not filtered properly or there's so much access that it builds up to produce these small stones. And these stones can be so small, they can get larger and larger to where non-pharmaceutical intervention may be needed, which could include a non-invasive surgical procedure or surgical procedure where the doctor has to go in and remove these stones. So I have had so many stories of patients coming in who have gone through the experience of kidney stones. And one of the symptoms of kidney stone is going to be abdominal pain or lower back pain as well. So do be aware of that. And it's very intense pain. Pulses and also very elongated pulses. So these pain tendencies can occur with for from a few minutes in sporadic pain, or it can occur long-term pain. And so when you experience that long-term pain, it's so intense that emergency help is going to be warranted. And so emergency prescriptions for pain medications will be given, or enough to help with any further episodes that may reoccur. So do be aware of that. So the only main side effect that a patient will feel is going to be the abdominal pain. Okay. Also, it's recommended that patients reduce the amount of soda in their diet. Also, reduce the amount of minerals again, and also drink plenty of water, 8 ounces of water at a time. Plenty of water throughout the week, throughout the day, so that the kidneys can help to flush out these minerals so that buildup and calcium do not occur. So be informed of that. I have I know of narcotics that are prescribed opioids, usually like a 7-day dosing of opioids. Also, there might be medical devices that may be given to help with catching kidney stones through the urine. And so, in case the disposition or the location of the kidney stone is further down into the urinary tract, it can be actually strained through a filter upon urination and then examined in laboratory to find out what the content of the stone is actually. Is it more calcium, or is it more of another mineral, or is it more of another substance? So do be aware that if we're able to um, strain the urine to catch any kidney stones, then that's what is most likely going to help detect and pinpoint the problem that's causing the kidney stone exactly. Okay, so also do remember to take in lots of water, plenty of water, 8 ounces of water at a time to reduce the amount of, to increase flushing and reduce the amount of occurrence. Again, opioids are given for about 7-day dosing, or also an NSAID can be given as well to help reduce pain. And it's also good to keep pain medications um, within reach in case a kidney stone exacerbation occurs. So once that occurs, you have the pain medication on board until you can get medical help, because it is an emergency situation, an acute situation. And I have never heard of anyone having to have a kidney transplant or anything like that, only pain medications and preventative care, which includes, again, your increasing water intake and reducing the amount of minerals in the diet. Okay, so do be aware of that. I personally have experienced kidney stones, and kidney stones are not my forte. Just to be in the know, kidney stones do occur over time. And again, there might be bouts of pain here and there, or it might be a long period of pain, abdominal pain, that occurs that will not let up. And once that occurs, then you say, oh, let me get some pain medication as ASAP, something that works very fast and will allow me to relax and get to where I need to be. Okay, whether it's emergency department or get some more pain medication or water, what have you. Also, another side effect is going to be heat, increase in body heat, increase in heart rate. Also, the tendency to want to relax and stretch out, because the abdominal pains are so intense that you will not want to have the experience to sit up or to actually move around. You want to just lay down, relax, recline in order to get that kidney stone moving out. Um, Also, but again, the best way to diagnose a kidney stone is to filter it through the urine, catch the kidney stone, have the doctor to examine the kidney stone, dissect that kidney stone, find out what is the exact content of the kidney stone, so you can pinpoint how to treat and how to prevent. So that's where I'm going to leave the diagnosing part at. Okay, so again, another side effect may be, besides abdominal pain, besides increasing heart rate, can be chills and fever, can be nausea and vomiting sensation, also can be diarrhea sensation, because those muscles are in the abdominal are contracting. So whatever is there in the GI tract is going to be moving. And that includes the sensation to vomit, the sensation to defecate, the sensation to push that kidney stone out and down out of the body system. The body sees it as uh, an emergency attack, and so wants to push those muscles very intensely to get that kidney stone out of the body. Okay. And most likely it's going to be a lot of urination, a lot of defecation, and nausea and vomiting sensation as well. And I can tell you firsthand that it's nothing to play with. It's nothing to to joke around about. Do make sure that you're doing the prevention first in order to make sure that overall you're getting healthier and less likely to experience kidney issues. So that's all I had today about kidney stones. The opioids are in therapy. You'll usually get a prescription for opioid therapy. You might not use it all at one time, but you'll use it until that kidney stone um, is moved along the urinary tract to be excreted. Okay. And again, immediate treatment will be needed. Usually, emergency treatment, where you might have to seek 911 care, or if not 911, you'll have to go into the emergency department for treatment and for care. So do be ready to experience that as well. For women, I would tell women it's more like a um, a, a period cramp, or a cramp where you feel like there's there's so much intensity in the abdominal muscle that there's a great push, like a labor push, or a if you've ever had that experience, or push to a push to urinate very frequently and intensely. So your doctor will likely do a urinalysis, and then they'll also likely uh, recommend you to a urinologist specialist, someone who focus on the kidney, a medical doctor who focus on the kidney, and that doctor will help you to uh, go into further examination. They'll usually go into the urethra and let and go in there and find any access to any kidney stone or any residue that might be behind in the kidney or urethra, so that the kidney stone can be extracted. So I do recommend that as well, to see a specialist that can help with actually going in more invasively. Okay, so those are my two suggestions: seeing a urologist specifically, and also if you're able to strain your urine with a strainer device specific for urination that can help to catch any kidney stone that may still be present in the body. You more than likely it still will be there after a urinary attack. Other than that, it might have already left the body at the point of um, so much abdominal pain movement. So if that occurs, then it's more likely that it's already left the body. But still, occurrence reoccurrence may present itself, so do be aware of that. And again, the best way to prevent is to drink just plenty of water, get plenty of exercise, get the blood working, get the blood moving, so that the body can help, the kidneys can help filter out all of that, all of the waste out of the body. The more waste that's removed, the less likely that kidney stone will occur. Okay, so I do am happy to give this information out. Um, to you, and um, the risk is most. I read the risk is most likely due to a family history or a genetic issue. So, if someone in your family experiences kidney stones, then yes, it's most likely that it may follow through generation. Okay, so do be aware of that. Limit the amount of sodium, protein, um, and also, I'm reading this right. Let me make sure I'm reading this right. No, no. Okay, so do be aware to limit the amount of calcium in the body so that calcification cannot occur and calcium blockage or the kidney stone cannot occur. So do be mindful of calcium sources. Um, if you're not getting adequate calcium through your diet, then most likely it'll be through like your multivitamin and sources like and specific sources that carry a lot of calcium. So do be on the know. And it's called hypercalcemia. Hypercalcemia is the name for increased calcium. And excessive consumption. So cutting back on dietary calcium in such a situation can have the opposite and under desired consequences of increasing GI absorption of calcium. So when the body detects that there's not a lot of calcium, the body will start to look for ways to increase calcium. So do be aware of that as well. Dietary calcium is essential for bone strength and health, tissue health, and proper nerve and muscle functioning. So, yes, calcium is good for muscle, bones, and also for organ function as well. Too much calcium can cause hardening of body organs, hardening of residue, and build up calcium stones. Also, we don't want to have the need for organ transplants. So it's best to reduce the amount of calcium. Also, vitamin D is a vitamin that helps to increase calcium in the body. Okay, so do be aware that if you're taking vitamin D, you might want to decrease that amount or visit your doctor to find out if vitamin D is worth taking so that the calcium component does not increase. Okay. All right, and then it's advised to drink at least 5 to 6 bottles of 8 ounces of water. 5 to 6, 8 ounces of water in a day to help flush out the blood system and reduce calcium blockage. Okay, so do be informed and leave any comments that you may have or any questions. Let me know. I can be contacted through email as well. And I hope everyone have a great day. And I hope that the information that I shared was very helpful. And this is sort of a blog today, but it's also very informative. Informative information, a good discussion to address, and for treatment, non-treatment, prevention, exercise, diet. Getting exercise and diet is always going to be your number one health prevention in a lot of disease states, and a lot, not all, but most disease states are going to be prevented by proper diet and exercise. Okay, so I hope everyone have a great day, and thank you for joining me. This is all that I had. Okay, peace.